What if your sciatica is actually getting worse because of the exact thing you're doing to try and get relief from it? Now, you sit down to get relief and you rest, and at first everything seems okay. Maybe you're at work or you're in the car or you're sitting at the lounge at home. Then it only takes a few minutes, you start to notice that little bit of pressure building up in the low back or buttock. That pressure slowly burns, starts to turn into more and more burning. The burning starts creeping into the back of the thigh. Before long, going right down into your foot, it starts tingling and your leg feels strange. And then you're constantly trying to shift around to find a comfortable position. You feel like you must have sat on an artery or something in your leg, like a nerve, and it's all getting compressed. So you lean up onto one side and then onto the other. You cross your legs, you uncross them, and you sit forward and you sit back, and eventually you find yourself standing up because the sitting has become too uncomfortable. Now, if you've experienced that, you're not alone. This is all too common. We see it all the time. And one of the most common things that I hear from people that we look after daily with sciatica is that, hey, I sit down to try and get relief, but then all of a sudden it feels like I'm sitting on a nerve. And then others might say, yeah, my butt cheek starts hurting after a few minutes when I'm trying to get some rest. Others, it's, the longer I sit, the further it creeps down the leg, and it just starts going tingly. And then these poor people, as soon as they get up, their pain's actually worse from going from sitting to standing. And they tell me that they feel like they're a 95-year-old and they can't straighten up. So chances are these patterns you can resonate with. It's not random. And there's a really good reason for why this is. So before we look at that reason, one of the biggest misconceptions I see is that people assume that it just must have been the chair. It must be the chair that's the problem. And they tell me things like, right, I bought this fancy new office chair. It's got all these gizmos. It's got this fancy cushion. I've adjusted my desk. I've even got a stand-up desk. I've tried everything, but it just keeps on happening. And I hear the same thing with cars. People go out and buy this obnoxiously expensive car with all these fancy adjustable bits with massages in the seats and all sorts of things. But then it just keeps coming back over and over and over again. And my response to these issues is usually the same. The chair or the car, it might be making it worse, but it's not the cause. And sitting is often where sciatica is going to reveal itself. So the chair, it just isn't the problem. It's probably that simply sitting is just exposing that problem. Now that's a really important distinction. So let me say that again. The chair may not be the real problem, but sitting may simply be exposing that problem. So these exact symptoms are what we call sitting-triggered sciatica pattern. So the sitting itself isn't causing the condition, but it's exposing how sensitive and vulnerable that nerve pathway has become. Now, one of the reasons this happens is because when we're sitting down, that sitting position actually puts more pressure on the low back, pelvis, and hips in a flexed position. So those with an already vulnerable or irritated sciatic nerve, that position will gradually increase more and more pressure through those structures of the low back, like the discs, like the pelvis, the muscles in the gluteal region, or on that nerve pathway. And in fact, you put more pressure on your discs when you're in that position through your lumbar spine when you're sitting compared to when you're upright, walking and standing. I often explain this to patients like a dimmer switch rather than a light switch. Really, do people sit down and instantly get pain? No. You sit down, you feel okay, and then 5 minutes later, the pressure starts building. We're dialing up that switch. 10 minutes later, the burning begins. 15 minutes, it starts tingling. And 20 minutes later, you can't handle it anymore. You're desperate to get up and move into another position. So if the nerve is already irritated, sitting just slowly turns up that volume. And that's why so many people tell me that the longer they sit, the worse their symptoms become. And what I find really interesting is that where the symptoms go will often change over time. So at first it might just be discomfort in the low back or buttock. We then find it moves outside of the low back and buttock and it starts running down into the hamstring. And people start to notice it comes down even further, down behind the knee, down to the calf. And because that nerve runs all the way to the foot, people can get symptoms all the way to their big toe. So people will tell me that the longer they sit, that pain will start to travel further and further down the leg. So again, for me as a chiropractor, that is really valuable information because the symptom, it tells us where it goes, but the behavior of it, that sitting and how that builds up, is a big clue as to what's going to set off that condition. Now, another thing I want to mention is that many people get worried that when sitting aggravates their symptoms, they think that something just must be seriously wrong. Because why would such a simple activity cause so much discomfort? Now, I want to reassure you that the good news is that that sitting triggered symptom does not automatically mean that your spine is completely ruined and busted. And the really important part here, and I want to get this across because the vast majority of people, and we're talking above 90%, it does not automatically mean that you need surgery. And it certainly doesn't mean that you've permanently damaged the nerve either. What they do mean, these symptoms, is that your body is giving you information. And the big question for you to really consider right now is, are you listening to that information? Because if sitting regularly causes burning, causes tingling or numbness or pins and needles, or those symptoms keep traveling further and further down the leg, that's usually a sign that that nerve deserves a closer look. So let's look at a few practical things that may help you during a flare-up. So my hot tip number 1 is that the first thing you want to try and do is when you're sitting, get your hips higher up than your knees. Now, for some people, that reduces the amount of flexion through the low back and pelvis, and that will take pressure off the low back and discs. Now, second thing is consider supporting the low back rather than allowing yourself to just slump in the chair for long periods of time. And my third hot tip is try to avoid sitting twisted or rotated or really cranked up in weird positions for long periods. It sort of goes without saying, but you're going to find that those sorts of positions are going to aggravate your symptoms. So just try and avoid them if you can. The other surprising one, and most people aren't doing it anymore, but I do see it from time to time where there's a wallet or a phone or a bulky object in the back pocket. Just get that out. I know it sounds simple, but people are unknowingly adding additional pressure through that glute region just by doing that simple thing. And perhaps the most important strategy is to just change position before those symptoms get severe. Just get up and move. So I usually suggest about 20 minutes at a time, get up and move your body. Now, many people wait until that burning, their tingling, or that numbness becomes unbearable before they move. It's too late once it gets there. Think of sitting tolerance as a guide. Now, if you know your symptoms, for instance, are going to start building up at 20 minutes, get up and move. Don't wait till 30. Stand up, walk around. It only needs to be for a couple minutes just to reset things before that irritation then ramps up all over again. So the key point here is that these strategies can help reduce pressure during a flare-up. They're not necessarily fixing that underlying issue though. So they're probably going to help you manage the symptoms while we figure out what's occurring and why it's occurring. But at the end of the day, release strategies can absolutely help you sit more comfortably during a flare-up. But, and this is the big but, if sitting keeps setting your symptoms off week after week, and I'm talking, we see people month after month and year after year with these symptoms just coming and going, we've got to figure out why. The bigger question really is, why is the nerve so sensitive to sitting in the first place? What is causing that nerve irritation? And that is exactly what a sciatica measurement and sciatica assessment is designed to answer. So at Aligned Chiro, we assess factors, numerous factors, posture, spinal movement, we look at nerve function, we look at symptom behavior, orthopedic tests, you name it. We want to understand not only where you're feeling the symptoms, but also why they're happening. Where clinically indicated, we might even look at imaging such as X-rays, MRI, SPECT CT. We want to find out and help build a clearer picture as to where it's coming from. So the goal isn't simply to manage those symptoms. The goal is actually to understand what's irritating the nerve and determine then what we need to do to stop that nerve getting irritated in the first place. So if sitting makes your buttock, your hamstring, your calf, or your foot start aching, burning, tingling, going numb, it's time to stop guessing. If you'd like to learn more, keep an eye out for our upcoming webinar where I'll be hosting a deep dive into the causes of sciatica, how sitting affects the nerve pathway, what assessments can help identify the source of that irritation, and the treatment approaches that may help. If you want answers sooner, you can't wait for that webinar that I'll be hosting, you can simply just book a sciatica assessment at Aligned Chiro straight away. We'll assess your posture, your spinal movement, your nerve function, your symptom behavior, so we can better understand exactly what's irritating that nerve and what your next step should be. You don't have to continue spending the rest of your life shifting around that chair in the car, trying to figure out what's going wrong. Let's find some answers together.